Cervical cancer is the 8th most deadly female cancer in Singapore. There are 190 new cases each year, and there is an urgent need to tackle this issue because the number could be significantly reduced. How? Well, it is one of the most preventable cancers through the HPV vaccination. But wait, what is HPV and what does it have to do with cervical cancer? HPV stands for human papillomavirus. It's known as the human papillomavirus because almost all of us would have contracted some form of HPV at some point of time in our lives. HPV is a sexually transmitted infection that spreads mainly through genital skin-to-skin contact. Dr. Zhou from the National University Hospital likened the virus to a common cold. It's a normal human virus. At some point, you are going to get exposed. You get it and you pass it on. There are over 100 strains of HPV, most of which can clear up by itself. However, there are high-risk HPV strains that can persist in the body and cause cells in the cervix to mutate and turn cancerous. This is where the HPV vaccination comes in. The vaccine can protect girls from cervical cancer by up to 90%. Yet in Singapore, the adoption rate of the vaccine still remains at just 3%. If more choose to go for the vaccination, we could potentially see a 50% dip in deaths due to cervical cancer. Therefore, there is definitely a need to increase the uptake rates of the HPV vaccination. In 2015, a campaign called Live My Sunshine was launched to encourage people to protect their loved ones by spreading word about the HPV vaccination. The campaign was largely informational and gave answers to common questions. Also, the audience could log on to the online platform to send their loved ones e-cards to encourage them to take the vaccination. However, there was no clear benefit in the campaign and it lacked amplification. There was little motivation for the audience to think about the issue, let alone go the extra step to send the e-card to their loved ones. So how can we add to the current efforts and get more women to take the HPV vaccination? First, we identified the group of women that was most at risk. Singaporeans reportedly have their sexual debut at the average age of 22.8 years old. Also, a study by Singapore General Hospital has shown that, specifically, Chinese women aged 20 to 24 have the highest HPV infection rates at 26%. Hence, we chose to reach out to young women aged 18 to 24 who have heard of the HPV vaccination but are still unvaccinated. Then we thought about what would be relevant to them. Through our survey, we found that cancer is a far-fetched issue to young women. I mean, when you're in your early 20s, there's obviously so much more on your plate to worry about. Now, this was an opportunity for us to test out specific message strategies that would increase the perceived susceptibility of cervical cancer among young women through the use of a richer medium such as videos. Since HPV is an STI, cervical cancer essentially starts with sex. No one really thinks about cervical cancer or about the HPV vaccination. But sex? Now that's part and parcel of life. With that, our campaign, The Flip Side of Sex, wanted to test if a sex-focused message could increase the target audience's perceived susceptibility towards cervical cancer. So what did we do? We showed two groups of women two different videos to see which worked better. One group was shown an HPV-related informational video by the Health Promotion Board. For the other group, we came up with an intervention video. This was an informal interview-style video that featured young women talking about what sex meant to them. The first half of the video talked about the positive aspects of sex. However, a twist came at the end when one of the interviewees shared that sex started her fight with cervical cancer. This contrast was used to emphasize the fact that sex could result in cervical cancer and that it could happen to anyone. At the end, we presented the key benefit to the audience, that young women can buy themselves a peace of mind with the HPV vaccination. This video was based off our key insight that despite our target audience's curiosity about sex, they do not usually talk about it. Even when they do, the more serious sides of sex, like STIs, are rarely discussed. So I guess the big question now is, Did a sex-focused message work? Yes, it did! Respondents showed higher perceived susceptibility after watching the sex-focused video as compared to those who watched the HPV-related video. Also, between the two groups, the one that watched the sex-focused video showed a greater increase in the number of people who were inclined to take the HPV vaccination. What do our results mean? Well, firstly, there is actually an opportunity for public health campaigns to tap on more provocative messaging in order to grab the consumer's attention. This finding contradicts other studies which have highlighted concerns about framing cervical cancer as a result of STIs. This is because it might cause increased stigmatization of cervical cancer patients or even the vaccination. For that reason, public health campaigns usually do not associate sex with cervical cancer. With that in mind, provocative messaging can be used but must be done with caution and sensitivity. Additionally, traditional health campaigns often use an informational approach, but narratives have been identified to be equally persuasive as they demonstrate lessons learned by the protagonist. Therefore, campaigners should consider the use of stories in their messages. So what's next? In our formative research, we found that respondents knew about the HPV vaccination via word of mouth, especially through family and friends. Yet, when asked about their most preferred source of health information, advice from medical experts came up top. This contrast is an opportunity for future campaigners to test the credibility and compliance towards these message sources in order to see which is more effective. And with that, we hope that we have at least contributed to laying the groundwork for more disruptive approaches to campaigns about the HPV vaccination. Thank you for watching, and do remember that there is always a flip side to sex.